Alright, how's it going, everyone? Triple T, recording from Nashville, Tennessee, with a review of my very first clinical rotation. Due to the passage of time, I will abstain from making a reflection on my final preclinical semester. Because this is my first rotation, I do not have an accurate baseline of comparison, so I won't have the most informed opinion. I just thought that this was a disclosure I should get out of the way first and foremost. But anyway, this 8 week rotation was divided into 2 weeks, 2 weeks, then 4 weeks. My first two were nephro, then 2 weeks GI, then lastly 4 weeks in the hospital itself. The nephro rotation was probably the most laid back in terms of hourly commitment. I actually hadn't attended on the first day because of the hospital orientation and Epic software training. And then after that, the attendings weren't available the next day, so I got off one more day. Whenever I was requested in the office, they would have me for about 4 hours. It was a relatively hands-on experience. They would ask me to see a patient and get their history. Sometimes they would tell me to ask a specific question, which I found very helpful in building my HPI skills. I still consider asking patients about home blood pressure and glucose if it may contribute to the presenting problem. Many patients were recently seen in the hospital from what I had noticed, so they would go from the hospital to the private office. You would see a lot of AKI and sometimes on top of chronic kidney disease, or just chronic kidney disease in itself. I did even happen to see one patient with polycystic kidney disease, but this was post-transplant. By and large, a lot of these cases were routine. I did go to the hospital a couple of days too. The consult rounds were maximum of 2 hours. Each individual encounter was only a couple of minutes usually. So overall, I personally found the office setting more valuable for my learning, but maybe somebody else would feel the opposite way. I really enjoyed this segment of my rotation as a whole though, especially having done it with a fourth year student that I got along with very well. I still don't really see myself in nephro at this time, but it could change. It was a very good experience regardless. After nephro, I had GI, which was pretty solid as a whole. The only thing I wish were different were just more involvement. On my first day, I got to watch a ERCP and a paracentesis. I didn't realize just how involved an ERCP was. Like, they made us don all this equipment before we went in, protecting my chest and my neck from X-ray radiation, and they took a lot of images to ensure the apparatus entered the occluded duct properly. Seeing an abnormal paracentesis was also a very good learning opportunity, because I didn't really know what it would have been based off of, just based upon these test questions are all learning based. They don't really show an image of an abnormal. The doctor explained what could cause the abnormal finding and the importance of the serum albumin ascites gap. There were no procedures in the OR the next day, and I didn't want to sit out if there were more days like that, so I just contacted the graduate medical education coordinator, and they gave me the phone numbers of GI doctors working in the hospital. I texted one of them. They invited me to observe at the office, so I found that I really enjoyed my time with this doctor, very accommodating and friendly, kind of like a parental figure. So I stuck with them for the rest of the rotation. The assistants at the office were also very good, and I enjoyed chatting with the anesthesiologist too. Overall, it was a very healthy social atmosphere. I'd be there for about 4 to 8 hours each day. Most complaints were within the realm of diarrhea or constipation, be it IBD or IBS. There were also plenty of upper GI cases, like, for example, eosinophilic esophagitis, GERD, but most of the time they were more coming from, we'll just say, the other end. In the back of the office, no pun intended, I got to observe colonoscopies and EGDs. They were mostly along the routine side. I did enjoy counting up how many polyps were in a patient's large intestine sometimes, though. There wasn't really anything particularly crazy, but part of my enjoyment of this rotation, really, I'd say even a good amount of it, just came from the people. And it makes me excited to work in a team setting someday. The last segment of the rotation was inside the hospital. I'd arrive at about 8 o'clock. I'd pre-round by just looking over charts. I would round with a total of 4 doctors throughout that whole 4 week segment, in addition to the nurses, PAs, and occasional pharmacists. I would say that most of the team was focused on discussing the status and management of the patients, but they were very receptive to questions and overall extremely helpful. And I even found that there was one doctor at the rotation site. They would explain the residency application process, and it made me realize maybe I should be taking it a little bit slower. I have so many questions at this time. Might be a little bit too late for that, but anyway, I just like having that interaction where they can explain things very well. And on top of that, I'm sorry, I'm just looking through the script. I was very comfortable on the rounds with the team. Most of the patients in the CCU, SCU were cardiac or respiratory in nature, as you might expect. There was something which was more surprising to me. For example, DKA being managed in a CCU setting. I would have thought that a medical floor could have handled it, but maybe not at this hospital. Just something that particularly stood out to me. It didn't rub me as a sin or anything. It was just surprising. Like, I don't want to say culture shock. Anyway, after I did CCU rounds, I did the hospitalist rounds. You could find someone who's on call by consulting the bulletin board in the CCU. I liked all the hospitalists I had worked with. They were very knowledgeable and they respected me and my time. The learning approaches varied between hospitalists. Some were solely observational, where I would just watch the encounter. More of the hospitalists would have me see the patient, look at their charts, and then give the presentation. So there was a diversity of styles. Some students might appreciate it. The hospitalists would use some encounters as a learning opportunity too, so they would explain the pathophysiology and management. As a whole, though, I did note they were very busy and didn't have the most time to teach. And honestly, it did make me feel a bit like a burden sometimes, almost like they were babysitting me, even though they didn't leave any indication that this was true. They were all very nice. It all just leaves me wondering if it's like this no matter where you go. I can't say for certain, but it wouldn't surprise me. Something else that concerned me on this rotation as a whole was just given that we rotated hospitalists every day, it made forming a strong connection much more challenging. Once again, I did like the doctors. I have nothing to gain from lying about that, but it just makes obtaining a quality letter of recommendation far more challenging. I personally had abstained from asking for one on this rotation, even though I was confident in my performance as a whole, and I did feel as though I worked very well with everyone inside the hospital. To just give a brief summary, I would recommend this rotation, absolutely. It was laid back, doctors were very nice. Whenever the doctors did make time to teach, I learned from them. Some of it was useful for shelf. Whenever it wasn't necessarily applicable, it was still conducive to bettering myself as a doctor. You will have plenty of time to study on this rotation, and I would think that you would enjoy it. I will see you all in my next review. It will be family medicine next time.